We're now joined by Howard Haughton, who is Chief Executive Officer of ENGLEWOOD Village in beautiful Paterson, New Jersey. Good to have you with us, Howard.
Thanks for having me. It's a pleasure to be with you.
Listen, we're doing this program at the end of 2021, seen in 2022. I actually just saw you in NJ Spotlight News with Congressman Pascrell and the mayor of Paterson as well, talking about this opioid crisis in your community, a grant that you received from the state. A, how serious is the opioid crisis? B, what are you and your colleagues doing at ENGLEWOOD Village to confront it? Because that wasn't your original mission.
That's correct. Our original mission was to feed the homeless, help the people that are hungry, that just didn't have access to everyday resources. And it grew. We've been here for nearly 40 years. We're celebrating 40 years next year in April. Glad that we're still here and we've grown tremendously. But that growth has shown that there's a big need in the community. Anyone that comes into Paterson knows the minute you get off of the highway, you see it. It's staring you dead in your face. The first light you get to, someone's coming up and asking you for help. It might be someone that has been using and abusing substances and they want help, but they're not able to accept it in that moment. And the fact of the matter is that that exists in every block that's in our surrounding community here. It's significant. It's prevalent.
How do you help them? How can you help them potentially?
Well, what we've done traditionally, the model has been to counsel people. Abstinence is one way. And it's typically when a person has gone through an overdose and they've been reversed and they're saying at that point in time, I don't want to go through that anymore, please help me. The numbers show for Paterson in 2020 that 2,400 people were engaged in treatment services. For us, this initiative, the ORT program, is different. Very simply, we're going out to the community before you're overdosing. We're engaging you. We're going into the highest crime-ridden area with the highest number of incidences. And we're going there with food. And this is where ENGLEWOOD is unique. We're taking food from our community kitchen. People donate food every day. We prepare it, we prepackage it. We go out with 100 meals to a site, stand there. Folks are waiting for us now to come out there. They're expecting us. We give out food. We're talking to you. We're engaging you. First thing is, if you're hungry, you can't hear what we're saying. But if we're feeding you, now you can listen, right? We can all sit down at a table and talk over a meal. And now that you're being fed and you have a relationship and a rapport and you're seeing me come out every week, now you're telling me your stories. And as a result of that, I can now say to you, I've been where you are. We have our peer recovery specialists who say just that. I've been where you are. Look at me. I'm no longer in need of what you're going through. Let me help you. And we're fortunate. We've touched in a 4-month period, 1,800 people, engaged 1,800 people in 4 months.
That means a lot more people because they have families. By the way, let's put up the ENGLEWOOD Village website as Howard is laying this out. I'm sorry I interrupted. Go ahead, Howard.
We have written referrals, 379 referrals. Those referrals are important because rather than saying, let's get you into a detox program or abstinence, we're now saying, hey, guess what? There's something called MAT, medication assisted treatment. That will allow you to fight that urge and curb that which you've been fighting. And then we can get you some additional counseling. So it's a combination of tools that we're using.
All right, let me jump in here. As you're talking about this very complex, it's not even one issue. The opioid crisis involves so many different aspects of not just a medical problem, a clinical problem, a health problem, a societal problem, a community problem, a quality of life issue. But it's exacerbated by COVID, is it not? And the work of ENGLEWOOD Village exacerbated and made more difficult because of COVID. Talk about it.
Absolutely. First and foremost, we know that COVID caused everyone to shelter in place, if you will. So imagine those that either were homeless or those that were down on their luck, just making ends meet one day at a time. And now they have higher stresses because of COVID, or those that were barely employed, barely bringing in enough income that can't do it now. It's actually caused an increase in need for support services. And unfortunately, we are not seeing that increase in money or revenue to meet the need. So it's hard for us.
So if we put up the number right now and we say you need volunteers and you're also raising money, it's not our business to be involved in fundraisers for nonprofits, but this is part of a series we're doing called Making a Difference. You are making a difference. You're a not-for-profit, as we are. but you survive, much less thrive, because of dollars, no money, no mission.
That's
Where's your money
exactly
coming
correct.
from right now? Is it corporate, foundation, and individuals?
So private donations are coming from corporate, foundation, and individual. We have special events, various appeals, but we also have grants that we get from the state and fee-for-service monies, because we not only have a social service component, we also have a clinical or healthcare component. So the healthcare component is funded through largely government dollars, low reimbursement rates, and the social services through private money.
But real quick, before I let you go, for some people say, you know, nonprofits, that's charity work, and that's nice, but it's not a priority. The reality is government can't do it. Corporations, their mission is different. And when we get support from them to do what we do, whether it's public broadcasting, what you do, your work is way more important. That's great. But nonprofits are the lifeblood of a community. 30 seconds, help us understand. Nonprofits are more important than ever before.
Absolutely. Let's understand nonprofits is just a tax status. At the end of the day, nonprofits compete against, that's it. They just compete against one another, right? And so you're wanting to, and that's why when you're giving, you're making a choice about who you're giving to. Are they making the greatest use of your dollar and having the greatest impact? So we've got to be competitive. We've got to be able to recruit and retain the top talent to provide the best services possible. And we're governed by healthcare regulations, just like every other healthcare institution.
Hey, Howard, I want to thank you and your colleagues at ENJBIZ Village for the work you do every day to make a difference in the lives of those in and around Paterson that are struggling disproportionately, just largely because of their zip code and their circumstances. And you have an open invitation. Thank you, Howard.
Thank you. Pleasure.
You got it. I'm Steve Adubato. Thank you so much for watching. And we had that website up for a reason. Find out more about ENJBIZ Village and all of the not-for-profits that we featured in our Make a Difference series. We'll see you next time.
Think Tank with Steve Adubato has been a production of the CAUCUS Educational Corporation. Funding has been provided by IBEW Local 102, Bank of America, Englewood Health, Delta Dental of New Jersey, the FIDELCO Group, the Russell Berry Foundation, PSC&G, the New Jersey Economic Development Authority, and by Johnson & Johnson. Promotional support provided by Jaffe Communications and by NJBIZ.
It only gets better when we stand together to tough through and get by.